Hello, hello. Welcome back. It's Module 1, Lesson 2, Physiology and Stages of Menopausal Transition in your Menopause Explained course. Right, so we're going to try to understand the stages of menopause, the menopause transition, and the physiology behind it. So the actual what is going on in your body. And of course, I have to give you my disclaimer and disclosure. Remember, this is not medical advice, it's education and information that I'm providing you. Please do learn everything that you can and then take that with you to your provider, be it a physician, nurse practitioner, or physician's assistant, and or some people see a naturopathic doctor too. And with this information, you can decide what you want to do with your own health, right? So, and I'm not paid by any drug company or lab or imaging company. So if I make a recommendation, that's just what I think. So there was a really nice study that created the straw plus 10 system. It's an overview basically showing, this is just an overview, but the straw plus 10 indicates there are 10 phases to the transition to menopause. And I've only separated them out into 5, which is you're in your reproductive phase, then you go into early perimenopause, then late perimenopause, then menopause, finally postmenopause. So there are, but the straw system breaks down the late perimenopause and early perimenopause into more phases. But because each person is individual, like we've talked about, and you don't fit into a cookie cutter, I I don't find that this system is useful for me in clinical practice. Someone else might find it useful. This slide is actually something I found on another website and I have borrowed it. And if anyone wants to message me that they know where I found it, because I want to give them credit for it, but I can't remember. And this is a little bit, sometimes the cognitive stuff with menopause doesn't necessarily 100% go away. That's my little joke here. But I can't remember exactly where I got it. And so I do want to give those people credit. This is a great slide. Look at, if you look on the left, you have your late reproductive phase. You can kind of see how the periods are regular. Your estrogen level is the green, kind of teal line. The purple line is your progesterone level. And you see how each month the hormone levels go up and up. And then you get into early perimenopause and you actually have a drop in progesterone. And I often have said to my patients, like, it's really about the balance of what's going on. It's not about one hormone, it's about the balance of the hormones has changed. And oftentimes for those patients, I've added a little progesterone. Sometimes I just have them get an over-the-counter plant extracted progesterone cream. They extract it from yams. This is something I've done for many years and for many women in this early perimenopause, and sometimes even it helps them continue. But a lot of times in the early perimenopause phase, that will just be enough progesterone to help balance out the estrogen and help with the symptoms. As you proceed through that perimenopause time, that progesterone levels really drop much faster. And then your estrogen levels transition down. Again, remember you're an individual. Things are going to happen differently for you than for the next person. This is just a kind of general guideline of what happens. And then eventually you get to that menopause, right? Where that big M is, and you're not producing estrogen and progesterone anymore from your ovaries. So you're in early postmenopause and then late postmenopause. I really love this slide. So again, this just kind of recaps that, your early perimenopause has the menstrual irregularities and your initial symptoms. And then your late perimenopause, you start to really, the cycles prolong and you have worse symptoms. And then finally, you're in menopause, it's 12 months of amenorrhea, which means no period. Amenorrhea, menorrhea means period, A means no, so no periods, 12 months. Okay, and then postmenopause, once you've hit that 12-month mark. You'll have lower estrogen, long-term health implications. Again, we'll still get to that. So what is happening? What is happening? Okay, it's not originating from your brain, right? Although they try to tell us it's all in our head. No, it's originating from your ovaries. Over time, you deplete, you run out of those follicles. Remember, each month, your ovaries are, when you're having periods, your ovaries are being stimulated to develop these follicles because they want to get pregnant, right? They want to create a dominant one follicle that's going to release an egg and get pregnant. That's our natural body. That's what we're supposed to be made for. So eventually we run out of follicles. The ovaries don't have enough left. And when they don't have enough follicles, because the follicles are producing the hormones, so your estrogen falls, your inhibin falls. This sends a signal to the brain, to the pituitary, and to the hypothalamus that your body needs more estrogen, your body needs more progesterone, your body needs more inhibin. So your hypothalamus gland, which is in your brain, sends a message, sends the GnRH hormone to the pituitary gland. And then the pituitary gland is being told, make more FSH and LH, because those are the two hormones that are going to stimulate the ovaries. So they rise. The FSH and LH go up because they're trying to really pour out lots of FSH and LH to make those ovaries produce more estrogen. And it doesn't work. It doesn't work anymore. Sometimes it works initially during perimenopause, and then it stops working. And you just end up with a very high FSH and you just have low estrogen. So it's all about the HPO axis, means hypothalamic pituitary ovary axis dysregulation, because during perimenopause it works for a while where I'm going to bump up the FSH and it's going to stimulate the ovaries, and then it works for a while and then it doesn't work, so you get those that irregularity and erraticness. And at the same time that this is happening, because of perimenopause and the drop in the hormones and inhibin, there's increased cortisol. Stress hormones are contributing to some of the symptoms. A lot of women I've seen come in to see me with, in perimenopause. We'll talk more later about, the weight gain in the midsection. But part of it is because of higher cortisol levels, and the way lower estrogen with higher cortisol is going to interfere with your insulin resistance and where you deposit fat. So, and of course, it's also that age in life, in let's say your 40s, when you have everything's going on. You've got parents who maybe need your help. You've got your kids who need your help. You've got maybe a spouse, partner, significant other who's driving you nuts. So, or hopefully they're supportive. I'm just joking. But these are all happening at once. You've got your job. This is like the critical point in your career. And so there is more stress in your life anyway. Now, the adrenal glands are also producing less DHEA, and this gives you less energy, libido, and mood. So sometimes I've recommended to some patients in perimenopause, and even sometimes in menopause, to take DHEA and over the counter 2 milligram supplement, and sometimes it helps with the energy. I will tell you a story about when in my first year in practice back in 2000. I joined a practice that had specialized in hormones, but had been around for a long time. And there was a little old lady who came to see me who I think her doctor had just retired at the same hospital. And so she was switching over to see me, hoping that I wouldn't be retiring before she didn't need me anymore. And she had been on testosterone injections once a month for years. And I had never seen this. Of course, I just finished a residency program, but I think my colleagues said it was fine to continue her, but to humor myself, I checked a bunch of blood work on her just to make sure her cholesterol wasn't crazy but she felt like $1 million because of that. So every person's different. We don't do testosterone injections anymore for women, but it was an early lesson for me that about individualizing care and that testosterone can have a lot of benefit. And that's where kind of the DHEA gets converted into testosterone. So it can be helpful. So what we learned in this lesson is the basic stages of your transition to menopause, what is actually happening with estrogen declining, your FSH going up, and progesterone kind of being variable, but actually declining, progesterone declining more than estrogen does in the early phase of perimenopause. And the reason this is all happening is that the ovarian follicles are becoming depleted. And so the hypothalamus has to kick in more to stimulate the pituitary, to stimulate the ovaries. And it's just very irregular and erratic. And on top of it, at the same time, you're having changes in the adrenal gland as a response. Okay. All right. I'll see you next time. We'll see you for the next lesson.